poorer cousin of the acute pediatric services, so I'm pleased, very pleased. I just want to mention school doctor, just introduce him very briefly, and I have a stand outside. Now, if anyone is curious about school doctor, it's a free online resource that my colleagues and I have developed, and it's basically an interface between community or neurodevelopmental pediatricians in school. And the whole aim is to bridge the gap between educational institutions and schools, because most of the time schools are not clear about what to do if they think a child has a developmental issue. Okay, so the whole aim is to identify, to aid early identification. And the good thing, and again I'm hoping to catch school tomorrow, is that they can also have free consultations with us if they log in as members. So I have a stand out there, and anyone who is interested can come and talk to me. So this is our team. And just to end, anytime I speak about ADHD, I always use this. If you can imagine, a lot of us here are wearing this. This is a lovely, lovely invention. If you have ever used glasses before, because I never knew this until as you get older, you use glasses when you are reading. You know, I started looking at my book and going like that. And then one day I was prescribed these and my world changed. And then at the same time, it gave me a clearer understanding of ADHD. And I use this a lot in my consultations with professionals and families. Just say to them, imagine if you are wearing glasses and you are told not to wear it. Your whole world becomes blurred. If we never invented glasses, a lot of us here will never be professors or doctors. Imagine an ADHD brain without their glasses. That is, they don't have their diagnosis, they don't have their treatment, and they don't have their management. It's like they are groping around in the dark without their glasses. When I use this example, parents cry, and they say to me, they see. Our children need their glasses to see. If we are wearing glasses and we don't think that glasses give us stigma, then giving your ADHD patient the right service, the right management, and the right treatment should not be riddled with stigma. Thank you very much.
Susan, lovely talk. I didn't get the chance to ask you this in September, but you have a lot of your service which isn't commissioned. How do you view sustainability for that service?
Yes, that's a good question. The sustainability shows in itself. The fact that it's not commissioned, it's still, what we do is that we still continue doing what we are doing, and what we do is that we are gathering evidence. So we are still not thinking that it's not commissioned and will never be commissioned together. So for example, the transition service, our transition worker who comes to sit in our clinics, we are going to be doing a little study about some of the patients that we've seen and their outcomes. And using those results, we are hoping to get our commissioners to commission some of these services. Because I know that commissioners do like results, and if you can't use anecdotal, sometimes you can't use anecdotal evidence. So hopefully it's going to be commissioned in the future to make sure we have that sustainability.
Thank you for that. That was really very good example. It made me cry nearly as well. Just wonder, what percentage of referrals end up having diagnosis of ADHD?
Okay, I can give you very, very roughly percentages, but I think they will be in the 90s compared to, so I can't give you a definite 96 point something, but over 90% do get a diagnosis of ADHD, because there's just so many layers of things that they do, because our referral, our pathways, educating. So it's a whole booklet that talks a lot about ADHD, so they can identify ADHD. And then our referrers know what to refer to us. And then when they come to us, we do a triage. So by the time we are getting the children, they've had all that, they've had all the information coming from schools, they probably should have come a year ago, so they are so much in need of having a diagnosis anyway. So majority of our children do get a diagnosis. Well, our prevalences compares with the national, quite nicely with the national prevalences. But I can say, because if we are saying that we're still not up to the 5%, but that means, you know, we're not treating moderate or mild ADHD. But we know from the results nationally that in this country, ADHD is still undertreated and still underdiagnosed compared to other European countries, even though we are aware that America and Canada may be a little bit high. Yeah, so it's comparable.
Okay.